And this starts from what ages do you usually recommend?
Yeah, so that's a good question. So we can kind of get into that. So when are babies ready to start to eat solids? So I think this has gotten a little bit muddy because there was some data that came out not that long ago about how early introduction of allergens is beneficial for babies. And I think that's sort of the message that most pediatricians got. That's sort of the message that gets repeated over and over. But the truth of the matter is that the data behind that is actually not very clear. And so my recommendation is to really wait until your kid is showing the signs of readiness, which is usually around 6 months of age. And if you had a preterm baby, that means 6 months corrected gestational age. So the data behind early introduction of solids was actually specifically looking at peanut allergy. So the introduction of peanut between ages 4 and 6 months of age showed to be beneficial, but only in kids that already had a known egg allergy or who were prone to allergies for some other reason, like for family history or some other issue. And so in those kids, like, yes, there was some benefit to starting allergy exposures early, but it was really specific to peanut. And so I think you kind of have to look at the risk benefit ratio, just like in anything else in medicine, where, okay, my kid is 6 months, but they're not ready really. Like, they haven't shown me all the signs that we're going to talk about. Is it better to wait, or should I just go ahead and do it because I know that this data around the allergens? Like, no, I think the answer is to always just wait. Just wait till your kid is fully ready, because that's the safest thing to do. So,
like, for food in general.
Yeah. So food in general, let's say 6 months. So I would say 6 months, and they have to be able to like sit up more or less unassisted. So if your kid is still like really struggling to just like hold their core posture, they flop over still, they're not quite ready. They really do have to be able to more or less sit up on their own. And all of this is because they have to be able to use their core to support like a safe swallow. So if they start to gag on food, which is completely normal, they have to be able to like engage their core, stick their feet down, and then like spit the food out of their mouth. So if they're still sort of like flopping around and not completely in control, it's probably not the safest thing to start them on solids. You probably should wait a little bit longer so that they can, do it with a protected airway, which is what we really like to see always. Obviously.
So here's like a controversial question about it. So like, say your kid is 6 months. And so like the American Academy of Pediatrics recommends 4 to 6 months because every baby develops differently. Some may reach those milestones at an earlier age than others.
Yeah.
And really, like you said, we're starting with just the basics. So like, it's the sensory. It's like a tiny little taste. It's holding something in the hand, putting it to the mouth. All right. So something a little controversial is like, if we wait till 6 months and we really want them to have those core strength muscles developed, which for some babies can be earlier, could be as early as 4. The American Academy of Pediatrics recommends starting feeding 4 to 6 months. And at that point, we're only talking about little sensory things, like they're holding something, they're learning how to put it to mouth, they taste something. So what about, if they're starting purees? So this is like the controversial part. So maybe if they start purees, you don't risk that choking and you get to expose them to the sensory a little earlier. And not that I'm absolutely. But I know that that's probably the argument I did. I don't know, a blog post or an Instagram post, and I got like backlash that I said as early as 4 months when people wanted, to see more.
Yeah.
The 6 month advocated.
Yeah. Well, I think like it's just like anything. I mean, it really is going to come down to the baby, right? Like, is the baby ready? I mean, my youngest walked at 9 months. Like, I don't know anybody else that did that. He's like baby Hercules. My oldest will wait as long as possible to do anything. So they're just different kids, Yeah. So I think it just depends. I think the best thing to do if you're really trying to foster independence and just enjoyment around food is, again, to just like listen to your baby. I think there's a big difference between taking a scoop of purees and kind of like force feeding a kid versus like, okay, I'm going to mash up a banana or I'm going to buy some baby food, whatever. And I'm just going to like let my kid smell it really quick. And I'm going to hold the spoon close and I'm just going to see if they, stick their tongue out and do this. And if they do that and I put a little bit on there, what do they do next? Do they enjoy it? Do they hate it? Do they start crying? Are they telling me to stop? Are they telling me that they're having fun and I should do it again? Like, really just listening, I think, is the most important like part of all of this. And so, I think as long as your kid is showing that they're ready, they're interested, those are the other requirements, right? So like they're more or less 6 months old. They're more or less able to sit up. They have more or less good head control that they can actually like, sit at the table or sit somewhere where you can, get them to participate. Flopping. Yeah. Where they're not going to just like land in the can of beans or whatever it is.
They have to hold their
head. Yeah. And then are they interested in it? Like some babies come out like ready to just grab your sandwich and try it. And other babies are so not food motivated. So I think it really just sort of like reading all of these cues and deciding like when you're ready to try.
How you want to read them, you're like what you described, the taste, the spoon, the touch, like that's like
Mm-hmm.
95% of introducing foods is that part, not like them
Yeah.
swallowing it. It's like really this is what the
Yes.
introduction is about.
Yes, exactly. And that's actually where the purees are helpful because I think the more we back off, like if we approach this from a perspective of like, okay, I'm going to just let my baby be in charge. I'm going to offer what I have to offer. Because remember, up until 6 months, they really do not need anything else nutritionally. And that's another reason we don't really recommend any solids before 6 months is because they're completely fine on infant milk, which is like breast milk or formula. But after 6 months, they're still pretty much good to go with just breast milk or formula until they're about 1. And so all of this is really just for fun. However, if you have a baby that's like really struggling to gain weight and you're hoping that the solids are going to help with that, then purees are actually sort of a better thing to rely on. Like I would lean more into purees in that situation. And the reason is that with what we talk about, like quote, baby-led weaning with soft foods or avocado, banana, sweet potato that's been cooked, things like that. Anything that's about as big as your pinky finger that you can smush between your fingers is sort of that's what we're talking about for traditional baby-led weaning. Those type of foods are great for helping the kid practice picking it up off a tray and sticking it in their mouth and maybe practicing to chew a little bit. But around 6 months is when they finally lose this reflex where they're just going to like spit everything out no matter what. And so the purees are actually a lot more likely to actually go in. So if you're working on calories for whatever reason, like the purees can be helpful because they're much more likely to actually swallow some of those. Whereas like these baby-led weaning foods tend to be kind of all or nothing. And at the beginning, it's going to be mostly nothing, I don't know if that makes sense.
Yeah, absolutely. So then what do you recommend in terms of like which foods you choose for baby-led weaning? How do you break it down? Size? Let's talk about all of that. What do you like?
Okay.
If I was a mom and like, what would you tell me to get started?
Yeah. So I say, again, like my point of view is that I want this to be as simple and enjoyable for everybody as possible. So I would recommend starting with the foods that you're already making for everybody else. Like my principle is that I don't want these moms out there trying to be a short order cook where you make this really nice little baby plate for your kids and then a separate like really fancy beautiful meal for you and your partner. Like that's just not a sustainable way of approaching this in my opinion. I would rather just have you make one thing for everybody and you can modify it slightly for the younger kids in your house. So like let's say you're making, I don't know, what are you going to make tonight for dinner, Lindsey? Maybe you're ordering, I don't know.
Is it Tuesday? Is it Monday? Monday. It's Taco Monday.
Okay, Taco Monday. Okay, so to our house, that would mean like some sweet potato, probably some like chopped up tofu cubes in the air fryer, probably some black beans, some guacamole, whatever else. Maybe like for us to be like vegan cheese and, tortillas. So maybe for a different family that looks different, but you could probably think of what you're going to be putting on your tacos. So it like just as an example, so what you would want to do then, so for me, I would probably dice up a bunch of sweet potatoes for everybody. But if I was feeding a baby, I would want that little strip of the potato wedge to be about as big as my pinky finger. And then I would want to cook it until it was soft enough that I could just squish it between my fingers. So that would be like something easy for them to hold and pick up on their own. Again, like they're still working on that pincer grasp around this time by now. Most of them don't have it. So you want to put it on something like in a bowl or a plate with edges so that they're not going to like just knock it onto the floor as they're trying to scoop it up. But something like that. Or you could do like some guacamole mashed up, like put it right on the high chair, let them get crazy. It's all good. Things like that. So I don't know if that gives you a sense, but not too small so they're not going to choke on it and just soft enough that they can kind of smush it and turn it into a puree on their own.
Okay. So this is this like gives me like helps me to breathe a little because I'm on the more antsy side and nervous about choking and take all. Yeah, I know everyone takes all precautions, but I will just be like very slow and like taking the next step. But what you described is almost like them allowing them to puree it and play with it in the hands. These are all squishy things for the most part because I've seen people where it's like I handed my kid a chicken leg and let him go at it. That's also considered
people are doing that.
And people do that, right? Or like, how do you feel about that?
Yeah. Well, there's also a bunch of theories out there about that. So people are saying like, well, for full jaw development, like I don't know if you've heard about this, but like there's a lot of talk about how kids anymore don't get the full jaw development because they eat mushy foods for so many years and they're so picky, and they'll have just pasta with like mushy stuff. And so they think that we should be like giving kids a chicken wing to just chew on and kind of practice using the back of their mouth. Which, like, I don't know. I'm not an expert. I would say, like, that's where I draw the line on my scope of expertise. Like, I'm not really sure if that's necessarily a thing, and I definitely am not familiar with the data about that. But yes, there is a school of thought that learning how to chew on like these hard and crunchy foods is really important for jaw development. So I think if that's the way that you feel and you feel strongly about that, that's fine. Just make sure you're offering foods that are not choking hazards.
Right. So I think that's where it's so confusing, because is that not, we're having chicken for dinner tonight, and yes, there might be a mushy vegetable, but like, am I putting pieces of chicken on the plate for my 6-7 month old?
I mean, I'm not, so it's hard for me to say, but I think like as long as it's soft, that's okay. No. Well, I think, like, let's just say, like, if there are vegans listening to this, like, let's just use this as an example. Okay. I don't want to get canceled, but I don't want to make anybody mad, but I would say as long as you've like boiled it and it's as soft as possible that your kid can essentially turn it into a puree when they squish it between their fingers, put it in their hand and stick it in their mouth, it's probably fine. So I would say, you know, like, anything that's soft enough that you can smash it is perfect for baby-led weaning, you know, and even things that, you know, are not going to break. Like, I would say, like, things that are not going to break into a million little pieces are probably fine for your kid to chew on as well, for just the sake of that jaw development and the practice. Like, you could give your kid a giant carrot stick, most likely, and if they don't have any teeth, there's no way that it's going to break off into a size that's going to choke them. Like, they could probably just chew on it, like, have a little bit of sensory, you know, hang out, see what it's like. I think all of that is completely fine.
Like, they're gnawing on it, but nothing's being enough where they can show
right, exactly.
Yeah.